my presentation on helping infection control through and prevention through hand hygiene, hand washing. I'm gonna go through a couple slides here. This presentation will take you through the who, what, where, why, when, and how of hand hygiene. Some important points will be reviewed to improve your hand hygiene practice. In this presentation, should be able to identify who should practice hand hygiene, describe what hand hygiene is, identify where hand hygiene practice should take place, explain why hand hygiene is important, describe when hand hygiene is to be performed, describe how to perform hand hygiene using various methods, and describe tips for success for effective hand hygiene. Any questions so far? All right. Let's see. How do most of y'all think we measure up to hand hygiene as far as hand washing? Do we think we do it great most of the time, all the time, some of the time? Okay. Well, let's just take a guess on which one it is. 95, 10, 65, or 40%? 40%. 65, 40%. Well, guess what? You guess 40%, you are right. Yeah, so that is very, very little. So obviously we're not using enough. And that's according to one of the Canadian studies here, but also US studies. Who, what, when, why of hand hygiene? Let's see here. Can somebody tell me what is hand hygiene? Keep your hand clean, hand washing. Okay. Hand hygiene includes cleaning hands with soap and water or alcohol-based skin rub in order to remove germs, also known as microorganisms. That is the official definition. Who should practice hand hygiene?
Everyone.
Everybody is correct. And it's not only for people in healthcare, but for everybody. All right. Where should you perform hand hygiene?
Anywhere, whenever your hands are sore.
Whenever your hands are sore. Yep. Basically, in a nutshell, anytime you come in contact with a patient, anytime you can see your hands are visibly soiled, as much as possible. That's basically what it is. That's the only way to keep down germs and stuff. All right. Points of care. This is a lot of times with the patient, healthcare provider, caring involving contact. Basically, anytime you come in contact with a patient. Why do we need to learn about hand hygiene? Prevent the spread of infection. Let's see what we got here. There we go. That is correct. Hand hygiene is the most important way to prevent the spread of germs. That's right. So using appropriate hand hygiene prevents contamination of patients, clients, or residents' environment. When do you perform hand hygiene? Is it before and after patient contact? There you go. Little pie showing us when and where. before initial patient or patient environment contact, before an aseptic or clean procedure, after body fluid exposure risk, after patient or patient environment contact. Doesn't just have to be the patient. It could be something that belongs to the patient. So remember your hand hygiene. So we got moment one, before contact with a patient, patient environment. That's before shaking hands, before transferring. Clean your hands before you enter the room. Alright. Of course, you already know that part there. Alright. Patient room, equipment, wheelchair, stretcher. Any contact with anything that belongs with that patient. So protect the environment, which in turn protects the patient. For aseptic clean procedure, clean your hands, handling dressing. Something happened here. Jump back here. Let's get back on track here. Yep. Handling dressings, touching open wounds, performing invasive procedures, prevents patient's own organisms from entering his or her body. So clean your hands immediately. Okay. After body fluid exposure. Contact with blood, body fluids, none, intact skin or mucous membrane, meaning the mouth, anything in that area there. Alright, I think we got the idea on that one there. Clean your hands after shaking your hands, transferring, making someone comfortable in bed. Clean your hands. You haven't got the thing yet, we're cleaning our hands. All right. After contact with equipment in your room, clean your hands. All right. I'm gonna take a quick review. 4 moments of hand hygiene are:
Before initial patient or patient environment contact.
2,
Before aseptic cleaning procedures.
and 3,
After body fluid exposure.
and 4.
After contact with patient or patient's environment.
All right. Now, how to perform hand hygiene, just gonna go through a couple techniques. Real quick, you got alcohol-based soap and water, and without water when hands are sore. Alcohol-based hand rub. Alcohol-based hand rub is the recommended method of hand hygiene in any healthcare setting. My hands are not visibly sore. Here's a link on proper video for washing with soap and water, but most facilities will have alcohol base. Basically, place a dime size of fluid in your hands. Rub product in the hand, palm to palm. Rub fingertips of each hand in the opposite palm, between and around fingers. Rub each clasp. I do have a little alcohol here if we want to, do a little example.
Yes, please.
There we go. Dime size.
Okay.
You gotta make sure you have enough.
Yes, sir.
not wipe off. That is the alcohol base doing its job. Alright. Make sure that your alcohol base is at least 60% ethanol alcohol. That's official one. Soap and water is a recommended method when hands are visibly soiled. Plain soap is used for the routine hygiene, while antimicrobial soap is used in acute care, high-risk areas, ICU, CCU, in that area there. Basically, wet hands under warm running water, apply soap, strip it over hands, rub hands together, 15 or 30 seconds, depends on where you get your information. With CDC, it's anywhere between 20 to 30 seconds. Rub fingertips of each hand and opposite palm between round fingers, basically the same thing you did with your alcohol. You know, you're gonna rub it. The only difference is that you're gonna rinse your hands thoroughly under running water, pat hands dry with a paper towel, turn off faucet using paper towel, dry paper towel, because water will transfer microorganisms. Hands are soiled and you don't have any water, what would you do? Occasionally you'll find yourself in that situation. Take a moist towel, wipe your hands. And this is like if you're not in the healthcare setting. Most of the time you're in the healthcare setting, you're gonna find soap and water or alcohol base, one of the two. So, basically remove the visible soil with the towelette, apply a dime side of the mouth. If that, again, do not wipe off. It's the same precipice as the alcohol. Little handy tips, no artificial nails, gel tips. When you have direct contact with patients, nail polish should not be used. Well, can be worn, but should not be used if it's chipped. Alright. Do not top off any alcohol, partially used hygiene product dispensers, because you can transfer organisms that way. Alright, got a little quiz here real quick on hand hygiene. Hand hygiene is the most important way to prevent the spread of germs. True or false?
True.
When washing hands, which of the following is important to remember? Wash with hottest water possible. The focus of good hand washing is the palms. Turn faucet off after disposing of your paper towel. Lather and rub hands together for 15 seconds. Right. Alcohol-based hand rub may be used instead of soap and water when hands are not visibly soiled. Correct. Which of the following is in the correct order when performing hand hygiene? Wet hands, apply soap, rub vigorously, rinse hands, apply soap. Wet hands, rub vigorously, rinse hands, apply soap, rub vigorously, rinse hand, turn off faucet. Wet hands, apply alcohol base, rub vigorously, turn off faucet. Yeah. When hands are visibly soiled and water is not available, how is hand hygiene performed?
Oh, they're visibly soiled, I know some
Yeah.
not. Okay.
C is correct. Well, this ends my presentation. I hope y'all enjoyed. I have some pamphlets here. If y'all wanna take a look at those, and that concludes my presentations. Any questions?
No.